Hello and welcome to this week's edition of Health Talk. Now, today is day 65 of South Africa's national lockdown and day 30 of it at level 4. And this, of course, is in response to the COVID-19 global pandemic. Now, for the first time, people are looking forward to a Monday. That's, of course, because on the 1st of June, the country moves to level 3 of the COVID-19 lockdown. So what's coming up on the program today? We'll be joined by the spokesperson of the Department of Basic Education to speak to us about the state of readiness for schools resuming classes, and this is all scheduled for Monday, of course. We'll also speak to the Acting Chief Director for Child Health at the National Department of Health about how COVID-19 affects children's health. A little later, we'll hear from a clinical psychologist about the potential risks of sending a child back to school and some of the challenges, particularly emotional, that they might be going through during this pandemic. That's all still to come on the program, so please fasten your seatbelts and watch, but get involved as well. But first, our senior producer, Zama Butelezi, will take us through the latest South African COVID-19 numbers. So good morning to you, Zama.
A very good morning to you, Peter, and our viewers. The winter season is here. In less than 48 hours, our grade 7s and 12s will be going back to school in most provinces as COVID-19 infection numbers continue to rise daily. Let's look at the South African stats. Tests conducted so far, we're standing at 680,175. Positive cases recorded, 20,240. Recoveries, we're standing at 15,093. Sadly, 611 people have since passed on because of COVID-19. And active cases, we're standing at 13,536. In our provinces, just like what we saw last week, the big metros continue to record high numbers, with Western Cape still leading with the highest infection numbers out of all the provinces at 18,906. Gauteng at 3,583, same as Eastern Cape at 3,583 as well. The Eastern Cape has always been behind Gauteng, which was once the epicenter of the COVID-19 pandemic, but as of yesterday, like I just said, the two provinces recorded the same numbers. Let's listen to what Premier David Makhura said while giving an update on COVID-19 in Gauteng province this week.
We went to 91 cases at the start of level 4. And in the last few days since the start of level 4, we have been, the number of cases, daily positive cases has been between 26, as you would see, and at the very most 75 cases. But on some days we were recording much fewer cases. But from last week, you would see from last week we started recording. We went back to 112 cases, particularly on the 23rd, May 23rd. We had our first largest increase in the number of cases. On May 23rd, we recorded 112. On May 24th, we recorded 100 cases. And on the 25th of May, we had our largest number of cases ever. That's 260 positive cases a day.
Let's continue with the provincial stats. KwaZulu-Natal is standing at 2,428, Free State at 231, Limpopo province at 170. Let's continue with the provinces recording the lowest numbers. Northwest at 143 cases, Mpumalanga at 112 cases, and Northern Cape recording the lowest across the country at 52 cases. As the country moves to level 3 on the 1st of June, government continue to advise all of us to continue observing lockdown regulations and practice precautionary measures by washing our hands with soap regularly, use sanitizers with at least 70% alcohol content, and continue to wear masks when leaving the house. Government still reiterates that people should stop the sharing of masks and also wash these masks with soap after use daily. Stay at home and only go out if we have to go to work or to shops if we really have to get those essential goods, and always observe social distancing. This is just to make sure that we keep ourselves and others safe and healthy. Back to you, Peter. Thank you.
Sama, thanks very much indeed. Now, so those are the statistics, but do remember that as we observe and report on these COVID-19 cases, those numbers can change, and sometimes significantly. Now, don't forget, you can also be part of the show by asking our guests some of the questions that you have on your mind, or you could just simply share your views on some of the issues that we're discussing. The number to call is 011, that's Johannesburg, 714-6841 or 6842. That's 011 714 6841 or 6842. We'd love to hear from you. Please give us a call. Now, as children in South Africa will be heading back to school following an extended break due to the COVID-19 pandemic, our question for you this week is, do you think sufficient precautionary measures have been put in place for schools to resume? You can send us your voice notes or video messages to our WhatsApp number, and that's 065 862 4548 065 862 4548, and please try and keep your messages to under 30 seconds so that we can share as many of your thoughts on social media as well. And don't forget social media at SABC Health Talk or hashtag SABC Health Talk, and also our Facebook page, SABC Health Talk. We'd love to see you all contributing and sharing your thoughts with us on those platforms. I'm Peter Ndoro, and Health Talk continues right after this. Hello and welcome back. You're watching Health Talk. Now, parents of learners at the old Bunting High School in Ngeleni in the Eastern Cape are concerned about the health risks that their children will be exposed to when schools reopen on Monday. As reporter Atula Joka found out, the school doesn't have running water and proper ablution facilities.
At first glance, it looks like a normal school, but going deeper reveals an ugly sight. Teachers and learners make use of pit latrine toilets, covered by corrugated iron sheets. It is now winter. The threat of the coronavirus looms large as the schools prepare to reopen next week.
Sithethile nabasemagunyeni ngesisikolo banazo izithembiso ngoba sezenzela ii-toilets sizilungisele zonke izinto esizifunayo sizilungisele kwisikolweni kodwa azikalungiswa nanamhlanje.
Ndandifunda apha ezaa toilet zazenziwe zemka nekanyama zazenziwe but zenziwe ngamazinki, nazo zazingekho safe kwangoko ndandifunda apha. Ibe ngamanzi, amanzi ayaphela apha, amatanki amanye angeni manzi.
Hayi, imeko yesisikolo ayisiphathi kakuhle sisi, kakubi kakhulu. Kamba asiboni uba izikolo zingavulwa ngendlela esibona ngayo, ngoba kaloku sifuna nezinto ezisephu zokuhlamba nenantuka neemaski zabantwana kwa iiklasi ezi ingathi ndibona ingathi azibonelanga kwabona ngoku because baninzi kwalapha ngaphakathi. Iwesi indaba yetoilet namanzi iziphatha kakubi kakhulu yona le nto. Ingasuba urhulumente kahamba walifikile iseba phala kwaprovince lisithi lizawuza nazo ezi zinto salinda kuba sisalinde nanamhlanje.
The Department of Education says school with water and sanitation issues will not be reopened. Learner support material will be provided at these schools.
We are aware that there are some of our schools that have inadequate sanitation facilities. All of those schools will remain packed at level 5 and as such will not be opened. And learners will be moved to adjacent neighboring schools whilst the department continues to pursue its program of infrastructure delivery. No learner will be exposed to dangers of coronavirus through unsafe sanitation or unavailability of water.
Parents want a sustainable long-term solution for the problems. Even though the education department says it might phase in and take time to reopen the schools with these challenges, parents are adamant this does not address or resolve the issues of ablution facilities at the schools. I am Atule Joga, SABC News, Ngoba Village in the Eastern Cape.
All right, so that's an example of the situation on the ground in the Eastern Cape. The Department of Basic Education's announcement that schools would start reopening on the 1st of June when the country moves to level 3 of the COVID-19 lockdown. For many, well, this has raised more questions than answers on the state of readiness for schools to resume. Teachers, parents, students' unions and education-related associations like school boards have raised some concerns that schools are just not safe and are not compliant with the COVID-19 regulations. Well, to talk to us about this, we're hoping to speak to the Department of Basic Education, Elijah Mhlanga, and we're hoping that during the course of this program we'll be able to get him on the phone or on Skype and just get a sense of the department's readiness going forward. Now, let's move on a little bit. The first case of the deadly respiratory disease COVID-19 was identified less than 5 months ago, leading to countries across the world closing schools, all in an effort to slow the spread, of course, of this new coronavirus that causes the disease. Authorities are now grappling with how to safely reopen schools amid a still evolving understanding of how the disease infects and affects children and how best to prevent them from carrying it to others. Well, to talk to us about how COVID-19 affects children's health, we're now joined by Dr. Leslie Bamford, who's the Acting Chief Director for Child Health at the National Department. Thanks so much indeed for joining us and welcome to the programme. Hello, Dr. Bamford, can you hear me?
Good morning and good morning to the viewers.
All right, okay, so a lot of our children are going to go back to school on Monday, and there's some anxiety, you would imagine, from a lot of parents wondering if it's safe or not. Let's start by just trying to get an understanding. In still general convention or conventional wisdom that children somehow are less affected by COVID-19 than their adult counterparts?
So yes, that is certainly true. There is still a huge amount that we do not understand about COVID-19, but we are learning every day. And it is very clear that for reasons that we don't entirely understand, children are affected much less than adults. What we mean by that, first of all, it does seem that children are less likely to become infected in the first place. But most importantly, even when children do become infected, in the vast majority of cases, they are either asymptomatic, that means they remain completely well, or they have mild flu-like symptoms. From all around the world, we have seen that even in countries with large numbers of deaths in adults, the number of deaths in children is extremely small. The other thing that we have appreciated more recently is that children also seem to play a much smaller role in transmitting the disease than we had thought. So the real reason for closing schools was in part to protect children, but also to protect their households, because we thought that children might become infected at school. They would have a mild disease, but they would go home and infect their older and more vulnerable household members. However, we are increasingly seeing that even when children become infected, as I say, they will probably be mild, have mild symptoms, and the chance of them spreading the disease to other children or to adults is smaller than we had thought. I must stress that the risk is not zero. Children do transmit the disease, but at rates that are far lower than we had previously thought.
All right, so on Monday we've got grade 7s and grade 12s, and then the age gap is quite significant. Grade 12, a lot of them are turning 18, so they are adults, a lot of them. And I just wonder if they're still in the children risk category, or are they starting to become more the adult category of risk?
So I'm not sure that we have very good data on that. They are certainly entering into the adult risk, but remember that the risk is not equal across adults, and the risk of developing severe COVID-19 infection is very related to age. So the people who are most at risk are people in their 80s, in their 70s, and as we come down, the risk becomes much lower. So the risk to young adults is also low.
All right. And so, as you were giving us our first answer, the risk of child-to-child infection is even lower then?
So it does appear that the majority of children who are infected have been infected by adults in households. There have been a small number of outbreaks, so child-to-child transmission, but those were definitely in circumstances where there were large numbers of children together, no social distancing being put in place. So overall, we are confident that the risks associated with returning to school are relatively small. I must stress they are not zero, and we do expect that there may be some transmission in some schools. The point, though, is that this situation is not going to get better. COVID-19 infection is going to be with us for at least the next year to 18 months. Probably we're going to experience periods of increased transmission for a number of years. And it's really not feasible to keep schools closed for that whole period. So we have been advised by our Ministerial Advisory Committee that they consider the risks to be low, and that they would advise that children return to school. Obviously, with all measures put in place to prevent infections and to make sure that any children who do develop symptoms are managed correctly, tested if necessary, and provided with the necessary management.
All right, let's talk a little bit about symptoms, because I guess teachers and parents at home would also have to start to kind of monitor their kids. Are the symptoms, do they present the same for children as they do for adults?
So absolutely, and one message, very clear message that we want to send to parents. Please, if your children are ill in any way, do not send them to school. In all likelihood, they will be sent home, but it's really much better for them and for their classmates that they simply stay at home until they are better. We know that we are entering the flu season, So many children are going to have minor illnesses. Please keep those children at home. One of the challenges with coronavirus is that the symptoms are very non-specific. So they are the same symptoms that we see in normal flu, a normal cold. Children, for the most part, present in the same way as adults. So they will present with fever, cough, sometimes some shortness of breath, sore throat, sometimes even less specific symptoms, things like headache, diarrhea and vomiting. So difficult to distinguish from other common illnesses.
All right.
A very small number of children, and I must stress that this is extremely rare, present with what we call a Kawasaki-like illness. Those children present in a very different way. They present with fever, with conjunctivitis, that's red eyes, with rash, and often with stomach pains. That is extremely rare. As far as I'm aware, I've not seen any cases in South Africa yet, but there has been a lot of media coverage of that condition, and we do need to be on the lookout for it. But again, just to stress that the majority of children who develop COVID-19 infection will either be asymptomatic, so that means no symptoms at all, or they will present with the common symptoms, fever, cough, loss of taste and smell that can be difficult to identify, particularly in young children. So fever, cough, sore throat, general malaise, general tiredness and body pains.
So you mentioned the flu season coming on, and kids are notorious for getting the sniffles and spreading it and that kind of thing. Does this flu complicate issues in terms of COVID-19, or they're just so different that you might have flu and the COVID-19, you don't become more susceptible to COVID-19 because you've got flu?
No. So the main problem is that it's very difficult to differentiate between the two. The only way really to do that is to test people. Now, of course, I'm sure that you are aware that we have some limitations on the number of tests that we can do. So in all likelihood, we are not going to be able to test every child who presents with these non-specific symptoms, fever, a bit of sore throat, bit of a cough. So our advice is that children with these illnesses must stay at home and have as little contact with other household members as possible. They must follow all the hygiene measures, wash their hands. They should stay at home until they are better. We have recommended that children who come to school with these symptoms should stay at home for at least a week. They should not be allowed back to school. And at that end of the week, if the child is better, then we may never know whether they had COVID-19 infection or flu or something else. But in reality, it doesn't matter as long as the child is better. Parents do need to be on the lookout, because if the child develops more serious symptoms, whether it's serious symptoms from flu or serious symptoms from COVID-19 infection, obviously those children then need to access medical advice or visit a health facility.
All right, so let's talk a little bit about, I don't know that you can prevent COVID-19. We know that you can do as best you can in terms of washing hands and so on and so forth, but it is about immunity, isn't it? And I just wonder what kind of things we could be giving our children. Is it orange juice? Is it lemons? What kind of things can we do to help boost their immune systems during this time?
Well, I don't think there's anything specific that we can do, but of course it's always good to keep our children healthy. To do that, we need to ensure that they have a healthy, balanced diet with as little processed food and as much fruit and vegetables as possible. And then, of course, the basic hygiene principles, washing hands, using clean drinking water, and those are the things that assist our children. For younger children, another very important issue is that children must receive routine health care, and particularly immunizations. Immunizations do not protect children against COVID-19. However, we know that during lockdown, for understandable reasons, our immunization coverage rates fell. And this puts us at risk of children developing vaccine-preventable diseases. And the last thing we want is that we protect our children from COVID-19, but we have outbreaks of other deadly vaccine-preventable diseases, such as measles, such as diphtheria. So I would really urge caregivers, if your child is due for immunizations, if your child missed immunizations due to lockdown, please take your child to your primary health care facility so that they can receive those vaccines.
All right, let's assume that your child is showing these symptoms and perhaps is a little ill, may even have COVID-19. How does a parent treat their child at home? What sort of care do you give a child with COVID-19 type symptoms?
So if the child has mild symptoms, then they should rest at home. That might mean going to bed, but generally resting. If the child has fever, we recommend paracetamol to reduce the fever. If the child does not want to eat, that is fine for a few days. It's important to make sure that the child takes enough fluids.
Right.
And with those treatments, the vast majority of children will get better because of the concern around COVID-19, but it's also true for influenza, for flu. The child should be, as far as possible, kept away from other household members. We would probably recommend that they continue to wear their face mask even when they are in the house. And ideally, they should use their own utensils. And we need to be very careful, families need to be very careful that they wash everything very carefully and clean surfaces regularly. The thing that we want parents to watch out for, this is uncommon in children, let me stress this, but in anyone who has confirmed or suspected COVID-19 infection, who develops serious shortness of breath, that's really the danger sign. If the person is developing shortness of breath, then that is a sign that they should access medical care. As a first step, they can phone one of the COVID-19 hotlines, but if they do not get assistance, then we would recommend that they seek medical care.
All right, okay, so I think we've got a couple of callers that are on the line, so if you could listen, let's just see. I think we've got Ali on the line. Ali, thanks so much for joining us. Do you have a question or something you'd like to say? All right, it looks like Ali's disappeared there. But I guess also, we're going to talk to a clinical psychologist later on, but stress and calming children is also quite important at this time, isn't it?
I think it is important because I think this has been a stressful period, we know, for many families, for many children. And I think we need to reassure our children. We must also recognize that despite all our best efforts, there may be cases that happen in schools, and we need to reassure our children and support everyone to respond to that in a calm way. But yes, children do need do need reassurance and support, because it is going to be difficult for them to go back to school. The school environment will be different to what they're used to. And I think they will all need our support during this period.
All right, Dr. Leslie Bamford, we're going to have to leave it there, but thanks very, very much indeed for all of that help and information. I think a lot of parents can take some of that on board and a bit more reassured going forward. Thanks so much indeed for your time this morning.
It's a pleasure. Bye-bye.
Bye-bye. All right, that was Dr. Leslie Bamford, National Health Department's Acting Chief Director for Child Health, talking to us about the risks of our children going back to school. And for some reason, we're not sure why, that children seem to be less prone to COVID-19, less prone to transmitting it as well. The risk is not zero, and she emphasized that. But they are somewhat more robust than us adults when it comes to COVID-19. All right, let's take a look at some of the messages that you've been sending and thoughts that you've been sharing around COVID-19. And this is what we've been getting on WhatsApp. And so with the first message, I myself don't think that it's a good idea that the government is not allowing adults to go out to work. So how can they send kids to go and die? So we were asking, of course, the question, do you think our schools are ready to open for education? Well, hi, I'm Winnie. I don't think schools are ready, especially in rural areas in the Eastern Cape. And the chances are very few, especially toilets aspects where there's one pit toilet for female toilets. Okay, that's not a great sign. Very stupid decision from the government, another viewer says. They haven't reached our local schools. I'm voicing this as a concerned parent. And another message via WhatsApp coming in. Morning, South Africa. No need to reopen the schools while the cases are increasing every day. And from Mrs. Ezobuka, I think it's not yet time to allow children back to school because the children are children and will behave like children. Of course, they don't social distance and all those kinds of things, don't they? Our kids are going back to school puts a huge concern to all parents, especially when we're in winter where the virus is more active. We simply feel that we're sending our kids to their graves. We've seen examples in countries where their health systems are stronger than SA and claim that they will take extra precautions, but kids still got infected. And the last WhatsApp message, morning, I don't think that our government is ready for opening schools. If one of the students or teachers tested positive, are they going to close the schools as they close health facilities temporarily? All right, so very concerned parents messaging in there saying that overwhelmingly that they're not happy. Don't believe that the schools are open. But Victor is on the line. Victor, thanks so much indeed for joining us. What are your thoughts as we count down to the opening of schools on Monday?
Thank you, my brother Peter. What I want to comment about, and my concern mostly, it's the media publicity that shows thrown out by our MECs and our Minister of Education. We have seen them went to well-resourced schools where the schools were told that we are coming, prepare yourself to demonstrate to the public that you are ready. But there are other people who are playing the country duty outside, who are going out like Dr. Ndlozi, who went to the Val area, where in the same area where our minister was there. Most of the schools there were not ready. And I say this even in my area where I am here. The school is not ready. I've seen that, and I'm the first one who's going to go to school on a Monday to check. But I just want to say, but at a very same note, I'm concerned about the comment from Dr. Leslie there. The issue is that no parent, whether the infection rate is few or it's minimal on the kids. As a parent, who want to sacrifice their kid to this virus?
Yeah.
One death is too many for each and everyone. And for a parent to lose a child is not something that you can accept easily. So I will say, as our SGPs must continue, as we saw the media reports that they are saying the schools are not ready, must continue to fight for the protection of our kids. We have seen last night, my last point, Peter, we have seen last night or early hours that North Korea opened schools on Wednesday. A few days later, they closed all the schools because they cannot handle the rate of inflation that happens to the small kids. So it shows very well that even developed countries cannot handle it. So I'm not ready. I call upon everyone not to take chances. Yes, it's everyone's right to take their kids to school, but it's a trap. Thank you, Peter.
All right, Victor, thanks so much indeed. Okay, so this concern, anxiety continues. The general sentiment that we're getting so far is that people are just not feeling that our schools are safe. George, you're in Gauteng. Thanks so much for joining us. What are your thoughts about schools opening on Monday?
You know, sir, to be honest, the school for reopening on Monday is not a good idea under certain circumstances, whereby, don't forget, the school is supposed to produce a readiness plan that shows everything is in place, which are necessary. If you check all our schools, even today, we still have a broken chairs where the Department of Education failed to fix those schools or replace those schools, those seats of the school, tables of the schools. So now we are talking about life, you see. Now, the life of our children will be in danger once we take the children to school. Because if you check, all the people which are talking, they're always in the office. They don't go out there and meet the people and see what's happening outside there. So we are talking about this. When we are out, we see all things, what's happening, what is ready, what is not ready. Even at the workplace, when we go to the workplace, you see the readiness is not there. The compliance is not there. How are you going to monitor your child while you are at home and then the children are at school? Because when you go to the school, teacher is one for a certain period. And then who's going to monitor those movements for touching? Which, because they always say you mustn't touch each other. Kids are kids.
Okay, so, Brother George, what do we do though? Because we can't keep our kids away from schools forever. This COVID-19 is going to be with us for maybe as long as 18 months or longer.
What I can tell you is only one thing. The strategy which they started to use of using the tablets at school, it was a good strategy, but at the end of the day, they leave it as it is instead of going forward with it. Today, those things, if it was active, we're supposed to know that we don't have any crisis because we should do an online teaching. But because our government doesn't care, they just do, they introduce something and then they leave it before they see whether it has a good result or not. But now it's needed, if you check. It's needed highly.
All right. Brother George, thanks very much indeed for joining us and sharing your thoughts and your concerns. We have an educator on the line now, I believe could be in KwaZulu-Natal. Thanks so much for joining us. I know that you want to remain anonymous. Your thoughts and concerns ahead of going back to school on Monday?
Good morning. Thanks for having me on the show. I have many concerns as a teacher and as a parent. As a teacher, I'm teaching in one of the schools that is considered less privileged, and my kids themselves attend ex-Model C schools, and I am witnessing this clearly. In my school, personally, kids were requested to report, and when they did, there was no screening, there was no procedure. We weren't notified beforehand how we should arrive at school despite asking on numerous occasions. Teachers sat in the staff room while they had a little meeting, no social distancing. My school is not demarcated, classrooms are not ready, and children are arriving on Monday or expected to arrive on Monday. And the other thing is we have no PPE for our learners, and our parents are not informed of that. And as a parent, my kids go to ex-Model C schools. I have received booklets regarding the procedures that will be put in place to accommodate for COVID-19. It really has reassured me as a parent because I know I don't have a choice in that I have to send my kids back to school eventually. But it is so clear where they will arrive, how they will proceed throughout the day, social distancing, even with regards to using the toilet. So how are we supposed to be kept safe? Because I've been keeping my kids in a bubble these past 10 weeks. And now I'm going to go to school myself and put them at risk because of the poor preparation in my own school. And things are being hidden because it wants to paint a rosy picture.
All right, very concerning, but thanks so much indeed for sharing your thoughts with us and your observations on what's happening on the ground. That was an educator, a teacher in KwaZulu-Natal who says that the school that she's teaching at is just not compliant at this stage. All right, now, as children in South Africa will be heading back to school following an extended break due to COVID-19, our question for you today this week is, do you think sufficient precautionary measures have been put in place for schools to resume? You can send us your voice notes or video us on 065 862 4548. That's 065 862 4548. You can also share your thoughts with us using our social media platform. That's at SABC Health Talk or hashtag SABC Health Talk. Or you can also go to Facebook and you'll find us at SABC Health Talk. So after the break, we'll be speaking to we'll be talking to clinical psychologist Naledi Mqai. Stay with us for that. Welcome back. You're still watching Health Talk on the SABC News Channel. Now, learners in the Northern Cape seem to be terrified to return to school with the country in the midst of this COVID-19 pandemic. Basic Education Minister Angie Motshekga announced that schools will reopen on Monday for grades 7 and 12. However, the Northern Cape's Education MEC, Mac Jack, says that these grades will only go back on the 8th of June, seeing that schools in the province are far from ready and that not all personal protective equipment has been delivered.
Meet Farron Williams, a grade 7 learner at Hurley Primary School in Kimberley. She's one of 2 children and wants to pursue a career in the arts. Her dream also started in grade 3 when she went for speech and drama classes, but she has now been forced to put them on hold by the novel coronavirus. However, she's schooled on what the virus is.
What I know about the virus is that it is a family of viruses. Little is known about the virus, but what I have learned is that the virus spreads rapidly. It causes many deaths. It is spread from person to person through droplets. When someone coughs or sneezes, therefore we should stay at home, wash our hands for 20 seconds, and we should sanitize regularly and wear masks.
Williams says she'll be more cautious upon her return to school.
I'm not going to share any of my utensils and my lunch. We should just wash our hands regularly. We should stay as far away as possible from each other, and we're just going to have to live like this until the virus is cleared and gone.
About 10 kilometers from where Williams is staying in Colville, we meet up with Janique Siekwe. Siekwe, a grade 12 learner at Floors High School, is one of 3 children. She's dreaming of being an advocate to seek justice for those in need. As Williams, Siekwe is mindful of her health.
I won't lie to you, but currently I'm experiencing a lot of mixed emotions, Mixed emotions in the sense of being excited to go back to school, like I miss my friends and I'm excited to see my teachers. But I'm extremely scared at the same time, because like the enemy is basically invisible. Like you can't see COVID-19. So like not only do you need to think for yourself now, but you need to think for your fellow learner as well. But I believe that if we comply by the rules and regulations set out by our brave president and leaders, and if the Department of Education has everything in place, then we can all be safe, and if we just like bring our part.
And if she was the basic education minister, she wouldn't have opened schools.
To be honest, I wouldn't allow schools to open, because it's like the coronavirus has reached its peak now. So I wouldn't allow schools to open now, because it's not guaranteed that nobody will die, and we are basically risking our lives.
There are mixed feelings around the reopening of schools. Teacher unions have made it clear that none of their members would return to schools if the necessary protective equipment have not been delivered to schools. For now, the dreams of learners like Williams and Siekoi are just that, dreams. Reginald Vidboy, SABC News, Kimberley.
All right, so as children across South Africa start heading back to class on Monday after this extended break due to COVID-19, parents are left with challenging dilemmas. Do I send my child back to school and risk infection, or do I keep them at home and face the possibility of children falling behind or even failing the grade? Understandably, some children themselves have expressed concerns about going back to school. To talk to us about some of the emotional challenges relating to sending our children back to school during a pandemic, we're now joined by clinical psychologist Naledi Mqhayi. Thanks so much indeed for joining us, and welcome to the program.
Good morning, Peter, and good morning to all the viewers.
All right, so I'm not sure how much you saw of that last package where we had a young teen worried about going back to school. I can only imagine if we as adults are concerned, young people, it's multiplied because they don't have the same amount of knowledge sometimes or life experience to manage anxieties such as these.
Okay, yes, I saw just a little bit on the young girl who was talking from, I think, Northern Cape. Hello, Peter, are you with me?
Yes, I was just saying, to describe some of the anxieties some of our learners were probably going through over this weekend, and what we can do for them.
All right, thank you for that. Peter, remember, the COVID-19 is it's a novel virus, as it is called, meaning it's something new, something unheard of, and also the whole worldwide is not really into grips with how to manage it, effectively at the moment because of the lack of the proper vaccination. However, we have to manage with life where we are. As you have rightly put it, people have to continue with their lives. We have to go back to work. Students have to go back to school because this is not promising to end anytime soon. So we need to find ways of coping in the current situation at the moment. Anxiety, without talking about anxiety as a mental condition, but anxiety as a mood, as a feeling, is something that human beings normally react with when they find themselves in a threatening situation. The girl was saying it very well. They fear death. They don't know if people are going to die from this. Of course, they hear in media, they hear everybody talking about how coronavirus is killing people. But again, human beings have that propensity of focusing more on the negative than on the positive. Not much is being said about the positive things that are coming out of this situation we're in. Not much is being said about how people are recovering from this COVID and how their lives are going on. Even physiologically, as the doctors rightfully say it, they probably have even more strengthened immune system than the others who haven't had it. And that is exactly where the anxiety comes from, focusing on the negative and being more scared of what is the potential of this virus onto the people. And children being children on their own, they may not have their own acquired fears. As children are born, they are born as free, open scripts. But parents and the environment they live in start writing onto those scripts. Some of the things that we write on our children is fears. If as an adult you don't show a confidence and a belief and an attitude that makes the child to believe that, oh, I am fine because I'm behind an adult, or whether it's a mommy or a daddy or a caregiver who are confident and strong and believe that we can overcome. Therefore, they will also show the similar weakness. So we transfer our anxieties to children by the way we are showing how we are coping with the situation at hand. So that's one of the issues that kids have to deal with. And again, when they go back to school, another thing that we're going to see, like we have seen with many other pandemics before, like the most recent, which was HIV, stigmatization becomes a big issue. Kids are going to face a situation where they're going to be stigmatized because they have similar symptoms. Even a common flu child will be called, oh, so-and-so has got a corona because they're coughing or they have a running nose, because kids are kids. They will mock around that person. But again, the duty comes on the parents and the teachers to educate and teach them. And kids learn to be more sympathetic. So again, stigma can be a stigma by association. If my parent has got corona, therefore other kids will assume that the whole family has corona, and everybody will shun away from that particular family or environment because they would feel that they have the same disease also.
All right. So, Naledi, one question that I have is, you've kind of warned us that we must be very careful how we talk to our children and the scripts that we used at home to create anxieties, and sometimes we do it subconsciously or not aware. I remember when I was a kid, I wasn't that kind of kid that asked my parents a lot of things, and I got most of my information from fellow children. And I just wonder, is this a time that parents need to step in and speak to children and reassure them more, because some kids may not even be asking and asking the wrong people?
Very true, Peter. Some parents, again, some families, some kids may not even have a good relationship with a parent who they're able to talk to. Some kids may not even have that parent at home to guide them. And some kids, you will find that they don't feel comfortable discussing certain things because of the nature of the relationship that has been there in the family. In that case, it doesn't say all is gone. A child has got their own support system, whether is it a neighbor, a friend's parent, or an aunt or an elder sibling, somebody that they can trust, that they can talk to. It is advisable that those people who are taking the role or the duty of parenting to the children sit down with kids, especially this time. This weekend, I think, is the best time for parents to be intentional now about teaching the kids. Sit down with your child, ask them questions. What do they understand about corona? What do they know about it? What have they seen? What is it that they are worried about? What fears are they having? And therefore, you will pick up from the answers that your child gives you, whether they are misperceptions, whether they are things that are not desirable that they say, or correct information. Then that is your opportunity to give them the adequate information, and then also work on their anxiety, calm them down, give them factual information, and reassure them that you are there, you're going to help, and you are there to listen. Should they feel again with today's curriculum, which we never had in our times, is that there's what you call LO teacher, the life orientation teacher. I believe the school identifies those kind of teachers because they see a more compassionate kind of a person who can act as a counselor for the kids at a lay level at school. Those teachers, I believe that one of their roles, especially at this point in time, is to be able to be that voice that helps the children in journeying through this process.
All right, Naledi, we're going to have to leave it there. Thanks so much indeed for sharing your thoughts with us this morning and giving us some insights on how to manage these delicate issues of emotions around COVID-19 with our children. Thanks so much indeed.
Thank you, Peter.
All right, that's a clinical psychologist, Naledi Mqai, speaking to us. Let's take a very quick call from who's on the line? Is it Kumalo? Thanks so much for joining us. Quick thoughts?
Hello, Peter.
Yes.
My take on this issue that learners should go back to school on Monday. It is a good initiative that they should go back to school because their future is at the center of everything. However, we are scared that these learners might contract this virus. But nevertheless, as the doctor said, that they are not that vulnerable to catch this disease.
All right. You know what, Kumala? Unfortunately, we've run out of time. It's so sad. I'm hoping that we can get you on the phone again next week. But to all of you at home, thanks so much for tuning in. Have a great week. Stay safe. Goodbye.